Welcome everybody to this webinar event on using location intelligence to address the impact of racial injustice on health equity. This is a part of a series on advancing racial equity in state and local government. My name is Kimberly Few, and I'm standing in today for Dr. Esri Garrity, Esri's Chief Medical Officer. Unfortunately, Dr. Garrity had an injury preventing her from being here today. She was very sorry to miss this, but wanted to assure the audience that racial justice and health equity are key areas that her team will continue working on. I'm joined today by several colleagues, including Clinton Johnson, a solution engineer and architect, leader of Esri's Equity Initiative, Piali Kundu, a solution engineer supporting local governments, and Jonathan Garrido-Leka, a solution engineer on the Health and Human Services team. The webinar will be recorded and we'll make copy of the slides for you. And also you can put your questions into the chat at any time so that we can address those at the end of the session. Here's our plan for the hour. We're going to start with some clarity on the topic of health equity and racial equity. What does it all mean? From there, we'll turn to approaches and solutions to address the problem, including some live demos from Piali and Jonathan. And we'll show you where you can start if you'd like to use GIS to advance your racial and health equity programs. We should have plenty of time for some Q&A at the end. There are a lot of terms that people use in this field, and while most of the terms are familiar, it can be helpful to ensure that we're really clear about what the different terms mean. So this is where we'll begin. We start with health disparities. Disparities are an outcome measure. When we have health disparities, we're saying that there's a higher burden of illness, injury, disability, or mortality experienced by one group relative to another. In other words, when we see disparities in health outcomes, we need to look for a systematic or structural problem. Here's an example. In 2013, Dr. Tony Iton, the Senior Vice President of the California Endowment, famously said, "When it comes to your health, your zip code matters more than your genetic code." This that year and brought attention to the role of geography in identifying a number of health disparities, like lower life expectancy in certain zip codes. This is a global phenomenon. Life expectancy can vary up to 34 years from one country to another. For example, a child born in Sierra Leone can expect to live for only 50 years, while a child born in Japan can expect to live for 84 years. The Colorado Department of Public Health and Environment showed this at a very local level. This map indicates the variation in asthma hospitalization rates in the Denver area. When we compare that to the percentage of the population that is non-white, we can see a clear correlation indicating that this problem of higher asthma hospitalizations is a health disparity likely linked to race. So there may be an issue of environmental injustice to assess. Race is one of the many factors that can lead to health disparities. We refer to the group of those factors as the social determinants of health, circumstances shaped by unequal distributions of money, power, and resources at all geographic scales. Our overall goal is to achieve health equity, and that's simply the state in which everyone has the opportunity to be as healthy as possible. But recognize that equity is not the same as equality. Equality is about being the identical in quantity, size, degree, or value. But that doesn't do anything to help people who have barriers to achieving good health. We need to meet people where they live, where they are. What we want to strive for is fairness, which is about eliminating unjust advantage or disadvantage. That's equity. So while equality sounds fair, equity actually is fair. Today, we want to focus in on the impact of racial injustice on health equity. As of January 12th of this year, more than 90 cities, 65 counties, and 5 states have declared racism as a public health crisis, with more jurisdictions mobilizing to make the same public declaration. By doing so, it's like putting a stake in the ground to signal an inflection point and compel action to reverse the deadly impacts of racism for Black Americans, Indigenous people, Latinos, Hispanics, and other people of color. That inflection point begins with applying a racial equity lens to addressing health disparities. Clinton will now show us how to apply that racial equity lens.
Thanks, Kimberly. So, people all around the world are trying to live healthy and successful lives. Communities are trying to make the best of their local resources. Families are trying to provide strong foundations for prosperity and health for their children. And children are just trying to live and grow up. and yet far too many are plagued by a wide and growing array of, of, of topics related to racial inequities. Some communities are dealing with underfunded schools and over-policing. Some families are dealing with intergenerational economic hardships and underemployment. And far too many children are growing up with limited access to tech, yet overexposure to toxins. And organizations are trying to apply a racial equity lens to examine and address disparities. A racial equity lens includes race and ethnicity, as well as religion, language, country of origin, nationality, immigration status. Moreover, those factors intersect with other social characteristics, including gender, sexual orientation, age, and ability, and characteristics that speak to class, like income, home ownership, and more, all of which either impact or are impacted by where people live, work, or play. So equity work is rarely about race alone. Racialized identities consist of all of these factors. So an organization trying to identify and address disparities in, say, asthma rates might explore population groups like Black boys between 6 and 10 living in median income communities, Latinas in their 20s living in high income communities, or white men in their early 30s living in low income communities. And we provide resources and guidance to help folks apply a racial equity lens to assess overlapping and interdependent systems of discrimination like racism, tribalism, xenophobia, homophobia, and so much more. In fact, Esri provides access to a lot of spatial data to help organizations to explore, understand, and confront these issues. Like how the W.K. Kellogg Foundation used spatial data to assess Black women's access to health care in New Orleans, and how Territorial Empathy in New York used maps, animations, and audio to show the impact of COVID-19 on communities over time. We also recognize that these inequities are intrinsically and structurally related, and as such create a wide range of experiences and outcomes for people across different communities. And we very often find ourselves focused on outcomes when thinking of inequities. Issues like disparities in chronic health conditions, infant mortality rates and birth outcomes, employment status. Yet racial equity best practices recognize the relationship between disparities in outcomes and disparities in the community conditions that contribute to those outcomes. And root cause analysis best practices recognize that inequities in outcomes and community conditions flow from decisions and practices further upstream. This model here is heavily influenced by the work of King County, Washington, and Race Forward. And in this model, outcomes are those indicators of how people fare. That is to say, how individuals, families, and communities fare socially and economically. Outcomes include things like educational attainment, school attrition, prevalence and severity of chronic disease, and many other social and economic results. Community conditions are the circumstances surrounding individuals, families, and communities where they live, work, and play. Community conditions include circumstances like access to quality health care, to education, to parks and recreation, housing and environmental conditions, and many other conditions across a range of concerns. And decision practices are the policies, programs, systems, and budget decisions that influence the circumstances surrounding individuals, families, and communities, impacting how they fare. And these include historic and contemporary practices and decisions by governments, businesses, and communities. Decisions and practices may create or sustain structural racism or other forms of discrimination, biased against or for people based on class, gender, or other social groupings, inequitable distributions of resources and power, or intergenerational inequities, meaning any combination of the above impacting multiple generations of families or communities over time. This model helps us understand and address the root cause of social inequities, including racial injustice. Today, we'll focus on health, so let's get back to that other equity-centered model for understanding health outcomes. The social determinants of health, which recognize that many factors impact health outcomes, including education access and quality, healthcare and quality, neighborhood and built environment, social and community context, and economic stability, all of which profoundly impact health outcomes. The social determinants of health align well with equity and social justice best practices for root cause analysis. The determinants themselves largely reflect community conditions that exist where people live, work, and play, all of which may be influenced by upstream decisions and practices. For instance, let's look at this study in Charlotte, North Carolina by Clean Air Carolina. The study highlights a priority area around the center of Charlotte. Residents in this area tend to have higher rates of negative outcomes, including behavioral risk like smoking and obesity, chronic conditions like high blood pressure and diabetes, and higher rates of death. There also appear to be disparities in several community conditions, including exposure to toxins. For instance, the historic West End, a predominantly Black community, has a disproportionately higher concentration of factories, waste sites, truck stops, and other large emitters of harmful air pollution. Looking further upstream to decisions and practices, we find that Charlotte has a history of segregation, of redlining, and that people in the historic West End live with a long-standing legacy of industrial zoning and highway construction, where time and time again, large sources of air pollution were sited in or near communities which had less wealth and less political power. These models can help you understand and address the root cause analysis of inequities. And Esri provides a wide and growing array of techniques and tools to help organizations understand and unravel interrelated concerns, address barriers to equality, and design a future where all communities are served equitably. And in this moment, amid a global pandemic that is revealing a wide range of racial inequities, leading to a wide range of disparities in how COVID-19 is impacting Black, Indigenous, Latinx, and Asian communities, including disproportionate health outcomes with Native Americans, Black people, and Latinx folks experiencing much higher rates of hospitalization than others. Challenges for children getting educated in online environments, which increase risk of poor educational outcomes for families that are already on the wrong side of the digital divide. And racial inequities and wage loss and business outcomes, with the pandemic putting nearly half of Black small businesses at risk for being completely wiped out, and putting Black workers at risk for compounding effects upon pre-existing economic inequalities. And while the pandemic has proven to be nearly 3 times more deadly for Black and Latino communities, racial disparities continue to create obstacles for addressing COVID-19. So government agencies and medical institutions are grappling with historic and contemporary racism that are a significant factor in vaccine hesitancy among Black Americans and others. With a history that stretches back to the 1800s when enslaved Black women were used in shocking experiments by people like the so-called father of modern gynecology, and includes the infamous Tuskegee syphilis study where the US government subjected hundreds of Black men to suffer believing that they were being treated for bad blood over a course of 40 years, causing African Americans unknowingly participating in the study to suffer blindness, mental impairment, and even death, even after real treatments had become available. A history that includes secret World War II chemical experiments on troops by race. And a history that includes segregated hospitals and the story of Henrietta Lacks, whose incredible cells were used without her knowledge and without her benefit to study the human genome, develop a polio vaccine, and so many other miracles. So the US Surgeon General and many others are working to direct community outreach efforts to acknowledge the harms of the past, demonstrate a commitment to change, and ensure that communities of color are well informed making their decisions around a vaccine. Many organizations are stepping up to do their part, recognizing that racial injustice is everyone's problem to address. And Esri is standing by our commitment to work with all of you to leverage the power of geographic and holistic thinking to increase understanding and to create solutions that ultimately will help bring an end to these long-standing injustices. Towards that end, last summer, Esri began by providing guidance and resources to help all of you map and understand racial inequity, providing a racial equity hub that includes examples of how other organizations have used GIS to advance racial equity, and curating and sharing relevant data to help you all visualize and analyze inequities in your jurisdictions. And over time, we've evolved this guidance to help organizations apply GIS as a framework for racial equity. And that begins with guidance for applying a racial equity lens. As we all know, race and place matters. And as I said before, Esri provides data, tools, and guidance to help you apply a racial equity lens to the community conditions and outcomes experienced in your jurisdictions. You can also integrate GIS with best practice workflows for advancing racial equity and social justice. The racial equity workflow is a critical aspect of applying GIS as a framework for racial equity. The workflow is derived from emerging and best practices for advancing racial equity and social justice. We have simply infused those standard methods with best practices for GIS and location intelligence. Organizations working towards racial equity need to inform and be informed by, as well as collaborate with stakeholders in and around their organizations. So engaged communities is at the core of this workflow to support your efforts to increase awareness, understanding, and collaboration at every stage of the process. So deploy the racial equity community outreach solution to enable your organization to engage stakeholders around focused initiatives and key metrics. Use surveys and crowdsourcing apps to ground truth your understanding of community needs. And use story maps to provide a complete narrative, putting the issues and solutions in the proper context. Organizations working to advance racial equity are also trying to proactively seek out racial inequities, identify clear goals and objectives, as well as measurable outcomes, all while engaging the community in the process. So the first step of the workflow is map and analyze inequities, meaning applying a racial equity lens to reveal and understand inequities, locate populations of concern, and identify barriers to equality. So at this stage, you can use Esri's Living Atlas to find data resources to enrich your own. You can use community analysts to produce infographics that help you to explore your communities. And you can find training resources in the Racial Equity Hub to help you get started or to take on challenging scenarios. With an understanding of where inequities are impacting populations of concern, organizations then seek to infuse their efforts with racial equity and social justice best practices, meaning ensuring that programs and services are distributed equitably, as well as delivering interventions and doing policy work to create real change. So the operationalized best practice stage is where organizations seek to design and plan equitable allocations of resources, alleviating burdens on communities of color. So we encourage users to leverage ArcGIS and all of its flavors to identify equitable resource allocations, automate the work, including the work of your teams on the ground, and inform decisions using the right configurations of our products, data, training, and services. Finally, organizations need to ensure that their efforts to increase equity are having the impact they seek. So in the managed performance stage, organizations use decision-making tools to visualize racial inequities at a glance to adapt strategies and operations dynamically. So use maps and dashboards to assess your impact and identify opportunities for increased equity. Compare your workforce, volunteers, and folks receiving your services with the community at large to ensure equitable delivery. And go beyond race to look at population groups in a nuanced way to more effectively assess and support the most vulnerable. And of course, some organizations may find themselves in the middle of operationalizing best practices or managing performance right now. So folks will also undoubtedly need to repeat this cycle periodically around any given initiative, program, or service, or any emerging issue that may arise. Just know that you can jump into the cycle wherever you are and keep moving through it in order to maximize your impact. To support your efforts to automate your practices, you can also leverage product and solution configuration guidance. We recognize that leaders across the globe are challenged with addressing racial equity in work happening across their organizations. They need tools and resources at their fingertips to inform decisions and actions to ensure that their work is creating benefits for marginalized communities and not burdens. So we're delivering solutions that align with your organizational workflows, as well as product configuration guidance to help GIS teams deliver the right maps, apps, and the right solutions to the right leaders at the right time. Finally, there's an envisioning process for enterprise-wide racial equity initiatives. We understand that many leaders in the health and human services space, including a growing list of racial equity leads, are working to organize and oversee racial equity initiatives and drive impact across the enterprise. So we're making available resources to facilitate the understanding of priorities, impact, and scope in a manner that creates, structured manner to create geospatial strategies that help leaders orchestrate the delivery of geospatial capabilities to drive racial equity throughout your communities. As you can see, Esri provides comprehensive GIS and location intelligence resources to help a broad range of racial equity and social justice initiatives, including health equity. In many ways, these resources reflect the emerging and best practices for advancing racial equity and social justice that the leaders working in and around your organizations have been executing and evolving for years. And we intend to continue to evolve guidance and capabilities as your needs and your efforts to address racial equity evolve. So Kimberly, maybe you can talk to us about how you can apply some of this racial equity workflow in a health context.
Sure. Let's talk about that. And let's look at how some of the things you can do if you're interested in using GIS to support your own organization's racial and health equity programs. Now that Clinton has outlined the racial equity workflow, we need to consider how and where that needs to be applied in health. So within these key areas listed, we need to pursue greater health insurance coverage, access to primary care and higher quality care for people of color within the healthcare dimension. Of course, our healthcare workforce needs to further embrace diversity, cultural competency, and multi-language proficiency to meet the goals of both a representative workforce and of patient-centered care. The dimension of health, safety, and well-being is where we take that broader population or community level view that impacts policies and programs and environmental changes in nutrition, physical activity, tobacco control, and all of the other factors that harm people's health. And finally, an area that perhaps should have been the first to mention, that of scientific knowledge and innovation. After all, how can we make progress in racial and health disparities if we don't standardize and collect adequate data on race, ethnicity, preferred language, and other factors that would allow for better understanding of the barriers faced by people of color? Without standards and regular collection of this data, it's all the more difficult to report and track on health disparities. Here's a framework for key action areas that GIS nicely supports. You begin by ensuring a strategic focus on communities at greater risk. This means identifying and mapping high-need areas that experience health disparities and aligning existing resources to meet these needs. For example, you can use pre-existing tools like the Social Vulnerability Index developed by the CDC or something more specific to get at your local concerns. Next, GIS can help you reduce disparities in access to quality healthcare. With GIS, you can better calculate and understand not only a person's or community's access to care and services via drive time, drive distance metrics, but you can look at walking access, public transportation access, and overall burden for a person to access care, to access it. While you assess that access, you'll spot the gaps. And that's where site selection capabilities of GIS support expansion of opportunities for healthy living, like access to parks, grocery stores, safe neighborhoods, primary care, testing sites, and even now vaccination sites. We've already discussed the importance of a representative workforce. In order to create that, GIS helps you characterize the community's demographic makeup and target strategies for recruitment. As I mentioned before, one of the best ways to support the research effort in this area is to have standardized data available at local geographic levels. If we aggregate our data at too large of a geographic unit, we'll mask what's really going on at the neighborhood level. And going hand in hand with the research agenda is the data collection effort. Tools like Survey123 make it easy to collect the data you need, even if it doesn't already exist. So Piali and Jonathan will now give us a demonstration of our capabilities for racial equity in health. So I'm going to turn it over to Piali and then Jonathan.
Thanks, Kimberly. Clinton previously introduced Esri's Racial Equity Community Outreach Solution, which is basically a templatized set of sites, surveys, and apps that are easy to deploy and can be used by health agencies and community organizations to communicate important health initiatives with constituents. The outreach solution is composed of three main components: a community engagement hub site, which is basically your one-stop destination page for communications and outreach with your community. The Racial Equity and Inclusion Community Survey, which allows you to collect rich information about race, ethnicity, and other community factors. And a Workforce Diversity Dashboard, which allows you to track the makeup of your workforce in relation to the communities being served. Taking a look at the Community Engagement Hub site, it's built on ArcGIS Hub, which makes it configurable and easy to augment and rebrand with no code. Right off the bat, we can see that we support some basic Google translation capabilities so that you can make your site more accessible to different demographies in your community. The template comes with several common sections. For example, an introductory section, which features a section to share supporting message from your leadership, communicate key focus areas and programs, and also report on top metrics so that you can have accountability and transparency. You can also engage directly with your community by providing surveys to share feedback or gather community sentiment, communicate other key program areas, and also allow the community to follow an initiative to get further updates. ArcGIS Hub also includes a lightweight event management system, so you can also share important upcoming events, and your constituents can actually sign up for and register for an event directly through the site. And finally, you can include an open data capability so that you can share important data with community tech partners. All of this is configurable, so you can add or remove sections as you need. Next, let's take a look at the Community Sentiment Survey. The Biden-Harris administration's recent executive orders place an emphasis on collecting data with the intent to identify disparities. The Community Outreach Solution provides a pre-configured racial equity and inclusion form template with different common questions, and it provides a simple way to start meeting those federal administration requirements and collect robust information about racial, ethnic, and social identities of your constituents. We can see here that we provide a lot of different design templates for different questions and data types and provide some common questions up front. It's important to note that this is all configured on Survey 123, which also supports multiple language translation, and it's flexible and even capable of complex logic calculations and other workflows like triggering webhooks, so triggering emails or text messages when a survey is submitted. The Community Inclusion Survey includes some pretty robust race and gender questions that can also be expanded on further. This is a great tool for community-focused organizations and health partners that are working with local government and health officials. Just to quickly take a look under the hood, we can see that we can easily continue to expand on this particular survey. So for example, if I want to be able to maybe add an age question here, I can just grab a question type from Survey 123's question bucket, add that into my survey, and I can even set certain questions to be required questions and enforce certain question formats and parameters. Robustness of data collected matters in enhancing how data is visualized and assessed. For example, showing representation of a workforce. So here I'm just going to a second page that's included in the outreach solution, which is a page that's specifically focused on workforce diversity. And this page includes the Workforce Diversity Dashboard. Representation is important in any industry, including the health industry, in order to build back trust between government and constituents. Communities want to know Who is involved in these conversations? Who's in charge of planning and distribution? And it addresses current issues. For example, vaccine hesitancy in certain demographies due to lack of trust in community agencies. Organizations themselves are also interested in seeing whether their workforce reflects the community. And it's important to establish concordance between doctors, medical assistants, medical professionals, and the community. I'm going to just go to a zoomed in version of this dashboard so it's easier to see. The dashboard provides two main parts. There's a summary report page that shows the racial makeup of the workforce in comparison to the community makeup. For example, can you see what's wrong here with this example organization? That's right. The Black workforce and Latino workforce hiring is very low compared to what their community makeup is. And it needs improvement in diversifying hiring or prioritizing target future funding towards diversifying the workforce and maybe hiring from underrepresented communities. Next, the details page provides key breakdowns, and specifically it combines race with other factors like gender and race with years of service. So we can see here again that the white makeup of this example organization is comparatively higher than Black and African American and other racial makeups. And this is also persistent across years of service. We can also add other filters. For example, if we filter on white employees, we can see that the average annual salary is comparatively higher than other races. All of these types of visualizations are very important. And finally, it is also important and powerful to be able to show racial makeup on a map. So here we've just included a simple map showing racial makeup within a community. And this leverages Esri's dot density symbolization technique to show one dot per every 1,000 members of the community. So it can be very important to show some of this information in a mapped form as well. So next, we've seen the components of all of the racial equity community outreach solution. Let's show you how to actually get access to this solution. You can easily access the solution straight from the ArcGIS Solutions app, which can be found in your app browser. When we get to the solutions page, we can filter on all of the racial equity solutions easily, and we can see which ones we've deployed. You can actually deploy these solutions multiple times in your organization at once. Just click on it and then click Get Now, and it will start populating all of these components into your organization. These are free to use, and you also have access to many other health solutions through the Solutions app. But sometimes you need to go beyond a solution template to do more specific analytics or create a specific product. Next, Jonathan will show some examples of other workflows and applications health professionals can build and utilize in ArcGIS for essential health workflows and decisions.
Thanks, Piyali. That definitely was a great demo. Now, I would like to talk about COVID-19, a topic that has exposed clearly many inequities nationwide. Now, COVID-19 has impacted us, all of us, in many ways. Some of us have family members that has been infected by the virus. And sadly, some of us has lost family members and friends during this terrible time. Now, we are concerned about high death rates anywhere. What you are seeing here, this map, is showing us in dark blue colors those counties with high death rates. But there are some of those counties where COVID-19 has impacted communities of color in a disproportionate way. Just to mention a couple of examples. In Chicago, there has been over 3,000 deaths, where almost 70% of those people were Black, even though Blacks represent only 30% of the city's population. Milwaukee showed us a similar case. 73% of all COVID deaths were Black people, who make up only 28% of the county's population. There are multiple reasons why those communities have been impacted in that way. Some of the reasons may be the lack of equity in access to health resources, but also access to the right information from their health officials. Health departments know that a single message will not resonate in the same way across every community. Also, they know that not everyone has the same access to the platforms where this information is published. The result is very concerning to health organizations who are putting a lot of thought into providing transparent and culturally relevant communication with the ultimate goal of reducing vaccine hesitancy. And here is where geography can help us. Here, for example, I am pulling a layer from the Living Atlas of the world. And you can see in dark circles areas where more than 26% of the Black population don't have access to internet at home. This could be key information when it comes to effective communication from health departments. But there is much more information that we can use to really understand our communities. And for that, I will use a functionality called Infographics. Let's start with Milwaukee. Let me start running this first infographic. Here, I can explore basically the different races and ethnicities for this community. In summary, this is the community's racial makeup. But also, I can explore specific topics using the community outreach template. And I can go through different key facts, such as household growth over time, as well as median age, and many other key facts. You can also see that we have specific data, such as the preferred communication platform for this community. Clearly, we can identify that more than 40% of these people still rely heavily in cable TV. And even we can identify the social media platforms that this community prefer. Finally, based on our demographic information, and let me zoom in here, you can see that almost 100,000 people speak Spanish at home. And more than 10,000 of these people would struggle if the messaging is only conveyed in English. Finally, I want to show you one of our last infographics, the vaccine hesitancy infographic that is based on a Pew Research publication. This infographic shows us or help us to understand better those factors that literature show us are related to vaccine hesitancy in a community. This is the kind of information that your health organization can use to craft more effective messaging with the goal of guarantee a more equitable vaccine distribution process. Another way health organizations can support their communities is making their vaccine distribution strategy more equitable by including key socioeconomic factors during their planning process. Here, for example, this dashboard shows us the total number of vaccination venues across the state of Georgia. The small blue dots are communities that are located within a 30 minutes drive time from each of these vaccination venues. These red dots, however, are communities that are outside that driving time area. You can see in the dashboard that we can quantify both groups of populations. But lack of accessibility is not only based on distance. Many times, other socioeconomic factors increase people's travel burden. Variables such as poverty level, age, crime level, and so on can be considered whenever we are crafting these workflows. Here, for example, we are taking into consideration the Social Vulnerability Index. This index, created by the CDC, refers to the potential negative effects on communities caused by external stress on human health. The closer to 1, the higher the risk of negative outcomes. This index can help us prioritize those communities that most likely will need a closer vaccination venue. For example, if I select Pharmacy 4, you can see that we have an SVI close to 0.7. So a health official could start thinking about ways to prioritize these communities or ways to deploy new vaccination venues in this area. Finally, monitoring our efforts is critical. It is not enough to implement these methods. We really need to make sure that they are working. Here we have our vaccination distribution dashboard. You can see that we have key indicators such as the total number of vaccination venues, number of doses, and many others. Also, on the right side, you can see that we are monitoring the percentage of populations who got the first dose of their vaccine in red, and those that right now have the full series of 2 vaccines in blue. In the same way, we can monitor our progress in terms of priority populations, age, race and ethnicity, and gender. In summary, ArcGIS provides you with workflows that can allow health organizations implement an equitable and speedy vaccine distribution. Back to you, Kim.
All right, so now let's talk about some of the things you can do if you're interested in using GIS or Geographic Information Systems, we apologize for not spelling that out at the beginning, to support your own organization's racial and health equity programs. We have several links for you that you can reference in the PDF of this slide deck, which we will distribute. You'll definitely want to spend some time exploring Esri's Racial Equity GIS Hub, and you'll find lots of relevant and authoritative resources for mapping and analysis of racial inequities. There's a plethora of data, blogs, and best practices available on that site. Also, take a look at our Health and Human Services Health Equity webpage. This is a good place to find relevant tools and read about what others are doing in this space. Speaking of tools, we have a racial equity community outreach solution, the stuff that Piali showed you today. This is all pre-configured and ready to be deployed and used right away. If you're not familiar with Esri solutions, they're ready-to-use templates that are offered at no cost if you already have a license for ArcGIS software. I'm including the landing page for this webinar series. It's a great site to bookmark so you can check back often to learn about the next webinar in the series. And finally, you can explore data in your own locale on our Policy Maps viewer. It's an interactive experience where you can check out data sets on social equity, economic opportunity, the environment, public safety, and more. The very next thing I'd like to ask you to do is fill out the survey that will become available at the close of this webinar. It's just 10 short questions that will really help us gain an understanding of your needs. You can influence our work on data, guidance, and resource development to better suit your needs. And if you'd like us to, you can ask for an Esri representative to give you a call for more personalized discussion about your equity strategy and your needs. And with that, I'd like to turn it over to Margot, who will moderate a question and answer session. Margot, do we have any questions to get started?
Yes, thanks, Kim. We do. The first question is, how can I get access to Esri's racial equity solutions, and do they cost anything extra?
Thanks, Margot.
Oh,
I can take.
go ahead.
Sorry, go ahead. I can take that one. So the easiest way to get access to the Racial Equity Community Outreach Solution is through the ArcGIS Solutions app. And you can access that directly through the app browser, or we can provide a direct link in our resources as well. It is free for individuals who have an existing license with ArcGIS. And can be deployed multiple times as well.
Thanks, Piali. Someone also asked, I like these solutions, but I want to add more to them. Can I build on top of these solutions, or do they need to be used as is?
Thanks, Margot. I can take that again. No, every single one of those solutions can be expanded, as we showed with the racial equity and community and inclusion survey. You can continue to use Survey 123 to build in additional questions to meet your needs. And all of those sites and dashboards can also be expanded to include any additional parameters, or you could remove sections from them if they don't meet your needs.
Great, thanks again, Piali. This question, I think, was more for back when Clinton was talking about equitable representation in the workforce. And there was a question about if you could explain a little bit more about why this is so important.
Sure, Margo. So just like any other organization's efforts towards equity, a big part of solving the problem effectively is bringing more voices to the table. So we're providing solutions to help organizations support their internal workforce equity efforts to help increase innovation in business and increase opportunities for success. And in the health space, that's more important perhaps than any other space. We're also helping from a more comprehensive health equity perspective. So folks who are looking to address the issue of racial discordance or concordance, ensuring that the available medical professionals reflect the patients that they serve, which has been aligned to studies that have demonstrated that discordance, so a misalignment of patient to doctor, is a predictor of decreased satisfaction on the part of patients. And there are still a lot of study out researching the connection between racial concordance or discordance and known issues concerning discrimination in the workforce and in healthcare in general.
Thank you, Clinton, for answering that question. And another attendee, Bonnie, asked about, this is an important question, about race as a social and political construct. And if you could talk a little bit more about social identity and how that's constructed and how that contributes to disparities in health access and outcomes.
Actually, that's a great question. I probably won't do it complete justice, but there is this notion that we sometimes accidentally say, where we say something like race is a factor, or race makes people vulnerable to higher risks. Well, race makes people vulnerable to this social issue that we call discrimination or bias or racism, right? Where based on societal ideas about what someone looks like is what race is largely based on, what someone looks like, more so than what someone's genetic makeup is, as there is no real connection between what we think of as race and biology or DNA. And as a result of what someone looks like, they may receive different treatment, whether it's directly in the healthcare they're receiving, because there may be some implicit bias going on, or as important, in other aspects of community conditions that they're exposed to, or outcomes that they're experiencing that put them at greater risk for health concerns. So race is a social construct. There's no genetic or biological fact that defines what it means to be Black or white. As a social construct, is very fluid. So from one country or region to the next, you'll find different ideas about what race looks like. Going from the U.S. to Brazil, you'll see a wide range in what people think of as the color palette that reflects society. Race is also not the same as ethnicity. Ethnicity being more about culture and geography, and what cultures and geographies people, you know, embrace for themselves. And all of those issues are still social in nature, not related to genetics or biology, and really impact people based on how society, businesses, government policies impact people different based on those social identities.
Thank you so much, Clinton, for taking the time to clarify that. We also had a question about, can you upload your own community level data to do further analysis and visualizations?
I think I can take that one. Yes, you can. You can definitely utilize your own community's data within these solutions, and you can upload them to ArcGIS and basically plug them into the existing solutions.
Great, thanks, Kelly. I really like this question. Someone's wondering if we have tools or recommendations for adopting a strengths-based approach for advancing health equity. For example, in addition to visualizing what communities lack or barriers they have to care, are there layers or different approaches to showing what resources are available in communities and can be leveraged, really highlight the strengths of communities?
Yes, absolutely. I wish I had a great example of an organization doing this, but many people are using, begin with really looking at what is available in communities and later applying a racial equity lens to see how things may differ for communities based on predominance or presence of communities of color. But very much starting with a story of what's going well, what's successful, how folks are striving and providing resources local within communities, and what cities are doing to drive success, and finding other ways to apply a racial equity lens to continue to ensure equitable outcomes.
I will add to that. Rancho Cucamonga, California put out a really good story map a few years ago about a 10-year project that they had undergone with the health department, looking at all the inequities in their community. And what I loved is at the end, they shared the results of those 10 years where they had seen decreases in heart disease, in diabetes, and in a number of different indicators where they were actually able to prove that their 10-year project has shown success. So that's something we can if you just Google Esri, Rancho Cucamonga, and story map, it'll come up.
Great, thank you for that example. We have another question from someone who was asking what options are available for organizations who might want to access these tools, but might not have the budget to be able to do so.
If no one else will take it, I'll start. So right now you can go to the racial equity website at esri.com/racial-equity, and at the bottom you'll see that there's an opportunity to make a request for support if your organization is dealing with a racial equity or social justice related issue, and you need to get some help right away, and we can get you connected with some location capabilities right away and some volunteer support to help you get started.
Great, thank you. And there's another question about site selection tools for finding areas that would help support or help identify the areas of the greatest need to provide support and resources to those areas. Are there specific tools that you would recommend to zero in on those areas with the greatest need?
I could take that one. Yeah, definitely. We do have workflows. One of those workflows that we normally recommend is in ArcGIS Business Analyst, where basically you have a suitability tool that will allow you to identify those factors that you consider are priorities for your communities, then you will be able to isolate them and, explore further how to address in a more equitable way the distribution of vaccines or any health resources to those specific areas. So yeah, I can, if they just drop their email, we can, contact them and just share with them some of those workflows.
Great, thank you. There was a question someone asked about whether you can speak more to the types of data available in the Living Atlas. What kind of information is available in the Living Atlas? And combining this with another question, someone asked if we have information related to child welfare. So if you could speak a little bit more generally to what is available in the Living Atlas.
There's a lot of data in the Living Atlas that speak to outcomes, maybe some data and community conditions. We've got hundreds of thousands of data sets from organizations across the globe. And what I'm trying to remember, there are certainly a lot of data sets that speak to how communities are faring. I would say start with policy maps, and if somebody can drop a link to that in the chat, that might be helpful. And you can look through the various categories and try to find some data that aligns with your needs there.
I'll also add that we have extensions of our products called Community Analyst or Business Analyst that have over 15,000 variables held within them. And that is what quite a few child welfare departments across the United States use when they're looking at their communities and figuring out where to implement new programs, place mobile clinics, anything like that they need to do to reach that community, especially where children are.
Thank you. Looks like we're just coming up on the end. We might have time for one or two more questions. There's one here about how food banks can use racial equity data that you showed today to address food insecurity.
We have many, many examples of people using ArcGIS to address food insecurity. We have just to start with, a supermarket access finder, which is a template that you can use. In fact, that is open to the public. You can Google Esri Supermarket Access Finder, or we can put the link in here and you can pop in your own zip code and see what comes up in your area. I actually use that in my community to help justify a mobile food truck for a community where 2 grocery stores closed. And then we have a lot of food banks across the country using us to assess where they need to up their distribution. And we do have a lot of examples. I think that if you were to send in a message afterwards, we'd be happy to share some specifics with you.
Yeah, and we have some training coming soon, online training in the form of a learn lesson to help folks figure out how to apply a racial equity lens in that context.
Great, and I think we just have 1 minute left, and I'm going to close with this one last question that's about reaching out to Esri and seeking guidance. Someone asked if they have an account, can they reach out to Esri seeking guidance in building a racial equity dashboard? If you could answer the question about how we can support people looking to do this work.
Yeah, if you are already an Esri customer and you know who your account manager is, by all means, reach out to them. We've got solution engineers across the board that can probably help you get started. If you want to dive more deeply, you don't have the time or the bandwidth to build that dashboard out, we offer professional services. They'll put together very brief retainer packages just to do something specific for you. So it's not a heavy lift as far as cost goes. And they can get those turned around pretty quickly, customized to your needs. We're doing that right now with vaccinations, with COVID-19, really across the board to help you set those up. So the templates are available if you have the skill, but if not, we're always here to help you with that as well.
We have so many great questions, but unfortunately, I think that's all we have time for today. So, Kim, I don't know if you want to close things up.
No, just thank you. Thank you for attending today. Please reach out to us with any questions, any need for more information. We have a whole team just looking at this issue and helping us with this, as well as people across Esri across the globe.